PSA Nizamabad, Dr. Narendra sir, Treasurer Rakesh, our fellow surgeons Kaushik sir, Silata madam, Ramesh and Ramna Reddy, అలాగే పీజీ స్టూడెంట్స్ ఇతర సభ్యులకు నమస్కారం. మనందరూ తెలుసు జూన్ 9th నుండి మనం జూన్ 15th వరకు సర్జన్స్ వీక్, సర్జన్స్కి శస్త్రచికిత్స నిపుణుల వారోత్సవాలు మనం కండక్ట్ చేస్తున్నాం. అందులో భాగంగానే అవగాహన సదస్సులు, బ్లడ్ డొనేషన్ క్యాంప్స్, పేషెంట్స్కి ఫ్రూట్స్ డిస్ట్రిబ్యూట్ చేయడం, అవగాహన సదస్సు, అంటే పీజీస్తో ఇంటరాక్షన్, మేము కొన్ని సలహాలు సూచనలు ఇచ్చి మీకు కొంత కెరియర్ ఎట్లా బిల్డప్ చేయాలి అనే దాని మీద మా ఎక్స్పీరియన్స్ మీకు ఉపయోగం ఉంటుందని చెప్పేసి ఈ కార్యక్రమం నిర్వహించాలని నిర్ణయించాను. సో మనకి ఇప్పుడు సీనియర్ సర్జన్స్ ఉన్నారు. సో మీకు ఏదన్నా కెరియర్ గురించి డౌట్స్ ఉన్నా కూడా సార్ అని అడగవచ్చు. నౌ ఐ రిక్వెస్ట్ డాక్టర్ జీవన్ రావు సార్ టు షేర్ హిస్ ఎక్స్పీరియన్సెస్ regarding how to build up the career.
Young surgeons, internees, my colleagues and fellow surgeons. 40 years ago, we were there in that seat and we had good teachers in those days. When I joined in 1986 in Usmania, only one ultrasound was there in the city, entire Hyderabad, that was allotted to Usmania with us actually. And later another ultrasound came to in a private sector, Aditya Hospital. So with those primitive investigations, we did number of surgeries in those days because outside corporate hospitals, they were not there. Actually, no corporate hospital was there when we did PG. Every case used to come to Usmania. So more of clinical assessment, clinical knowledge for coming to the diagnosis, establishing diagnosis, more of history taking and clinical diagnosis. Last 4 decades, we have seen many changes. And at that time, there was no distraction from the social media. Right now, which we are having, we are concentrating only on studies, learning. Now, the scene has changed. What we observed for the past 40 years, just I want to tell briefly. Nowadays, what we observed is, most of the younger generation, they are not sparing time to take proper history taking. You have to spare adequate time to listen to the patient and thorough clinical examination. Those two things are somehow lacking nowadays. Mostly depending on the investigations. Whatever may be the investigation, we must correlate with our clinical findings. Clinical findings, we must give topmost importance. For the past 10 years, mostly they are depending on the investigations. Whatever complaint they come. Few centers, they are not, for pain abdomen also, they are not laying on the table and examining. Just for symptoms only, they are writing investigations. That should not be done. So learning also during these 3 years, because after completing PG, you will not have time to learn properly. This is the golden time, golden opportunity for us to utilize it to the maximum extent. We should not waste time in any other activities these 3 years because you don't get. Just now I saw you are doing very good amount of surgical work. Almost all cases you are doing here. I am quite happy with the surgical work here because most of the common people, when we refer the cases to government hospital, still we have to convince them to go to government hospital so that everything is available there, every surgery they do that. We are, in spite of that, most of the patients, even now they are not willing to come to the government hospital. But after seeing this, because almost on par with any Hyderabad center or corporate hospitals, we are doing every work, but that is not being known to the common people. What you are doing, that should be known to the people so that they can utilize. Those who, especially poor people who can't afford outside treatment, they can utilize it. Regarding learning, you must concentrate on, just now I told you, history taking. Proper history taking gives us a lot of information if you ask them properly. then thorough clinical examination. These two things are the basic things for us. So you must concentrate on that. Any investigation, even latest MRI and PET, every ultra-modern investigation, they should give a second importance. We must correlate. If they are correlating with your clinical findings, you must take it. Of course, you have advantage of the latest technology. In those days, there were no monitors actually for anesthesiology. Pulse oximeter, monitor, nothing was there. When we were medical students, even IV cannulas were not there. IV cannula, IV sets disposable. Only rubber tubes was there. When metal, steel needles were there. With that, we happily practiced in those days also. But now you have got luxury things, but most. How best you utilize them, how best you utilize this modern technology is one thing important. And any surgical case, you must have thorough pre-operative evaluation. Here we are seeing few cases. Without assessing properly, they are posting the cases. After opening, if something else is found, they are just closing and referring it to a higher center. In private setup, a few cases we notice. That should not happen. You must come to a most probable diagnosis before taking any case for surgery. First of all, indication for the when not to do surgery is more important than when to do surgery, that you know all. So thorough clinical examination and intraoperative also, you must take adequate time. It may take 10 minutes, half an hour more, but you have least post-operative complications if you spend more time during surgery. That is also basic thing. And every time how perfectly you can do, you should aim at that perfection. Nobody is perfect fully, but we must try to be as perfect as possible. And patient safety is first. Intraoperative also, one more thing I want to tell you. Different anesthesists come in private setup, whatever it may be. Every anesthetist is not the same. So as a surgeon, as a responsible person for the patient safety, we must observe certain things during intraoperative period also. If bloodless field is there, you must suspect hypotension. Nowadays they are connecting it to the monitors and relaxing. I am not blaming anesthetists. Earlier they used to monitor closely. That because they are depending on the machinery, mostly they are connecting. So as a surgeon, we must notice all those things during surgery. If the blood color changes, then you must suspect hypoxia, something is going on, especially GA. All those things, if you notice, you must alert the anesthetist so that to avoid you are hearing on-table deaths, immediate post-op deaths. They are just mostly because of lack of simple attention. Intraoperative parameters, post-operative also, till they recover from the anesthesia, anytime they can go to hypotension and cardiac arrest. So once the patient is shifted, no proper person will be there to take care of. Even in private setup also, in our setup, we must observe them till the effect has gone. That also we must take care of. Even 1 in 100 also, that becomes a very big problem. So pre-op, thorough evaluation, thorough pre-op checkup, intraoperative, post-operative period. Post-operatively also, we must attend the patient because surgeon who did the surgery, if he attends, then only the patient gets assurance. You operate, some other fellows is. So that's not the case. When you take up the responsibility, you must attend it to at least second, third or fourth post-operative unless the patient is. So these things I want to tell you. And regarding after completion of the PG course, what are you going to, the super specialty or settling in some other places? You choose a better place where you want to live comfortably. Actually, our profession is it's a part of our life. Life is different, profession is different. Wherever you feel comfortable, you can settle down there in private setup or in institute, whatever it may be. So your life becomes comfortable. Initially, you may not have better this thing, but if you settle down there, slowly you can establish your practice, you can have all those things. So that you must choose, you must determine because you have come to a certain age where you want to settle down. That place, if not first 5-6 years, after that also you will have comfortable life there only. You don't change. And empathy, sympathy to the patient satisfaction is always important in our profession. Personal attention to the patient, and the patient should be satisfied with your services. If you have those things, then availability and reasonable skill is also more important. If you have these qualities, wherever you go and practice, you can be a successful surgeon. You don't compare other people, you don't think about competition. Patients trust you. Whoever comes to you, you must satisfy them, you must give a reasonable care, reasonable skill, both psychological as well as service. So those things will definitely help you. If you have any other doubts, you can ask afterwards.
Good morning, everybody. We are here to, share our experiences and listen to your problems, which you are facing in your routine, studentship, whatever I should say, internship and post-graduation and all that. So now, as Dr. Jeevan Rao said, he is elder to me, but I came in 87, he came in 89. That way I am senior to him, but he is elder to me. So I give due respect to him that way. So anyway, when we came, as he said, ultrasonography was there in the Usmania, said. When I practiced in Nizamabad, no ultrasonography was there. Only X-ray was there. So any appendicitis, what used to do is just take a simple plain X-ray abdomen, just rule out any stone is there or not, and then we used to operate. And mostly with the clinical diagnosis. So later on, of course, the ultrasonography, CT scan, MRI and all these have come. So again, you should know what investigation to write. And it all depends upon, the financial constraints of the patient also. Now, just because it is available, we should not write all the investigations and burden the patient. Okay, that empathy and patience towards the patients, you should have that attitude right from the beginning of the career. That's more important. And of course, as I said, clinical diagnosis is more important. The clinical judgment, acumen, that you should follow, right? Not only depending upon the investigations. So many times investigations mislead us. So first don't see the reports, first see the patient and then see the reports. Then only you will be able to unbiased diagnose you can make in your mind. Otherwise, just the patient gets all the reports and you see all the reports and then you're biased. You will go in that way only. Whereas if you just first see the patient properly, make your own diagnosis, then you see the report, then you will know whether it is how far you are right and what best you can do. And regarding the, as he said, as you come out of the post-graduation, now you can settle wherever you want, but now the situation is like this, that those parents, those who have their own institutions or hospitals, they can run their show with their, the boy or girl or daughter or son, they can join that. Whereas to set up an independent nursing home or hospital, at present situation has become very difficult. As a lot of, permissions you have to take, right from DMHOs, and even if it is nowadays, earlier it was 15 meters was the height for fire and NOC, fire NOC. Now even less than 15 meters also you have to take fire NOC. So that has become like that. And again, labor department and professional tax, you have to pay the income tax. So many, and PCP, NDT, lot of, this thing we have to, stringent rules have come. So, instead of concentrating on our practice, we have to follow all these things, like what rules are you discriminating or you are bypassing the rules, that tension will be there. Now our practice tension anyway is there. So all these things are also there. So therefore, most of our, super specialists, they are joining Yashoda, Apollo and all those things, right? Because, no headache. If you have your own hospitals, you have to, as post-op, you have to see, isn't it? And any problems, you will be facing the issue. There, at least the hospital will face the issue. Of course, that was, what do you call that, says vicarious liability, what do you call in legal terms. So that will be there. When you are operating in any other hospital, that vicarious liability as a surgeon, that will be there anyhow. But, it will be shared there. When you have your own hospital, that entire will fall on us. So I am not discouraging you or anything like that, but these are the facts which are there in the present scenario. Okay. Right. And regarding the pre-op evaluation, as our colleague has said already, you should thoroughly evaluate preoperatively. And then when you're doing a surgery, you refresh your anatomy. That whatever surgery you are doing, refresh your anatomy and then go for the surgery. Even though you are perfect, but not for simple cases, but little complicated cases and all that. So in that case, you'll be well equipped, and check all your equipment whether they are functioning well or not. If you're doing laparoscopy, all the equipment is working well or not. Last moment, if you just go and start the case, of course daily you will be doing that is right, but you enter somebody so that he will just check everything. You also counter check, so that you should be well armed before you are going surgery. And on the table also you should take good precautions. And speed is not the only criteria. Speed is not a matter for your surgical skill. Initially, you develop the surgical skill. Then later, once you become more confident in all that, then definitely the speed will, you can increase. That is there. Okay. And post-operatively, be in touch with the patient, and then any complication is there, you just tell openly whatever you expect, because we are not gods, isn't it? So if you hide anything, then the problems will be there. If you tell right from the day one, and before taking up surgery, you will be taking informed consent, right? Informed consent, that you mention the specific complications which you are expecting, so that patients are well aware of the complications. Of course, there are a lot of complications there. If you tell everything, patient will not get operated at all, they will run away. That is also there. But at the same time, you should main complications which are expected, that you should tell them, and take the signature and all that. And if any complication arises, tell openly to the patient. These complications are usually, as I mentioned earlier, before surgery, this happened, and you are tackling it. And at the time, you involve all your colleagues, doctors also, in your locality. And just you should have a good relation with all the doctors in your locality, so that they'll be supportive. See, competition will be there everywhere, but at the same time, our surgical fraternity, we should have a good coordination and a good friendship, so that but suppose you have become senior now, any junior has called you for help, immediately rush to his help. You should not feel that why you should go and all that. So anything can happen to you also, isn't it? So that important thing, you should always share your knowledge, and if anybody is in emergency, you should help them. Okay. And of course, when you go there, when you do an operation there or you assist them, you should write in the notes also. You should mention there that at what stage you entered the operation theatre, and at what step you help them. That thing you have to write down there, because if you don't write any notes or anything like that, later on, if something happens again, that you will escape. That is what you feel. You don't escape. Yeah, the doctor who has called you, they will definitely inform. No? That's the specialist you have called, or senior doctor you have called. So therefore, you should write down the notes there, so that it will be clear in the future. Suppose if anything happens also. So, and regarding the patient's attitude, what I told is that is very important. You be sympathetic with the patient. If any complication arises, do tell them. We'll try our level best, and God is there to help us. That is what you should tell them. Don't ignore. And regarding the bill also, like sometimes, suppose if the patients are poor and if any complication is there, you have to forego, or we have to take a little less bill, so that if you insist on taking the full bill and all that, then later on they will have issue with you. We have paid so much and the patient has not been properly treated, or is not successful or anything like that. So, and one more thing, we should not guarantee a case. What happens is, you say guarantee everything is I'll do well, and the operation will be successful and all that. That operation will be, will try to make it successful. That is there, we have mentioned, but you don't mention the word guarantee. Guarantee is we can't say in our surgical or medical terms. Only these quacks, they give guarantee. We don't give guarantee, right? Because we don't know any B-complex injection also, sometimes they get a reaction. As you have seen in the word ciprofloxacin, we write routinely, they have got such a allergic reaction, isn't it? So that way, so certain things which we learn in our experience, that we are sharing with you. And if any doubts also there, you can just ask us. We will try to help you out. And you people should work hard and learn during these 3 years. We have able doctors helping you, all of you. They're all ready to help you out. So we just concentrate on the work and do well in your career. Wish you all the best.
Myself, Dr. Venkatramana Reddy. Well, surgery is just an art, and to master it, you have to work hard. And knowing what to cut is not very important. Knowing what not to cut is very important in surgery. What to cut, even our technicians will come to know. But what not to cut, we have to know. So work hard for it. Intelligence and common sense has very less role in your career. Hard work and mastering the technique is very important to be successful in your career. I wish all the best for you all.